30 seconds. 30 seconds. In 10, 9, 8, 7, 6, 5, 4, 3, 2, 1.
Good afternoon, everybody. Happy Monday. Here with Paul and Josh and Rob Simulcare. Rob is the chairman of the Connecticut Lottery Corporation. You'll hear from him in a few minutes. Brief daily summary update. This is numbers since Friday. I think you can see we're closing in on 300,000 COVID cases. And these are the ones we know about really over the last year. And as you know, early on, there was not nearly much testing. Still doing a lot of tests. The positivity rate ticked up just a little bit. We're seeing some of the same in New York and Massachusetts. All stay within a narrow band. Still pretty stable. Watch out for Miami Beach. I see a lot of spring events going on down there, and make sure if you went down there, don't go. Stick around here. The weather's been great, and if you happen to have gone down there, get tested before you come back. Get tested at Bradley Airport, and make sure you're okay. I see a lot of people running around there. Hospitalizations continue to go down. Deaths at 9. Remember, that's a 3-day number, so it's, I think, good news that number continues to go down. Hospitalizations and fatalities, the key metric that we've been focused on, especially in this time of vaccination. Where are we on the vaccine update? Over half of our folks 45 and above have now been vaccinated, at least had their first dose. 75 and above is almost 80%. I think you can see 36% of all adults over the age of 16 have received their first dose, 36%. And we figure, like I said, during the early days, we had a lot of people get infected on top of the 300,000 cases we know. So there's a lot of folks who have some sort of antibody built-in immunity. So that gives us a little bit of protection over and above the percentage of people who have been vaccinated. It's like a natural governor to what's going on, unlike this guy. And I think that's going to make a difference going forward, and that's why our trend lines continue downward in all the key metrics that make a difference. And that's why we've 45 and above has been open. We had, I think it was 80,000 appointments made since Friday morning. 22% of all the people 45 and 54 have already been vaccinated their first shot. I said, Josh, that seems like an awful lot in a short period of time. He reminded me a lot of them were healthcare workers, educators, and daycare, so they were already in the process of being vaccinated. And that's what we assumed in our budgeting. I think it's worth noting on the next track, we opened up a little bit differently to vaccinations than other states. We did it in a very methodical way, age-based, narrowed the aperture, so you didn't open it up to everybody, first come, first serve. AP wrote an article recently saying those states that opened up too widely, too fast, where you had websites crashing, people waiting in lines, nothing there, like South Carolina and Florida, they ended up having a lower percentage of their people ended up getting vaccinated than states like Hawaii and Connecticut and some others that were more focused narrowly in terms of opening it up on a methodical basis. And it's also worth remembering that states like Hawaii and Connecticut, which are more age-based, a lot higher percentage of our elderly are vaccinated. Unlike some states like South Carolina and Florida, where it's a little more first come, first serve, they skew younger. So that's made a big difference for us in terms of, again, fatalities and hospitalizations, and that's made a difference, as this next graph will tell you. This was a headline in the Hartford Courant, I think just a few days ago. Seniors seen the biggest drops in fatalities and deaths. That's the red line, 80 and above. Same thing as we saw in our nursing homes. It reminds you the vaccines work and the vaccines are safe and they're making an enormous difference. which is why we were able to continue opening cautiously with 100% occupancy last Friday. That said, we have to continue our outreach, especially for Black and brown populations. We have some of our towns where you have 70% of the eligible population has been vaccinated, and some of our cities where it's more like 35 or 40. So we've got to do a better job of getting people vaccinated there. And this is just something we're rolling out now. It's the mobile vaccination vans. We have 35 of them scaling up. We'll have them end of this month and really in April when we get all the vaccines, the widest supply. At the same time, will be opened up to everybody without age group on April 5th. These vans will be able to do 160 doses a day. They'll be in the church parking lot at the end of the service. They'll be in other congregate settings, housing. So we're taking the vaccine to you to do everything we can to expand our reach. Susan and I have been to a lot of facilities where we're making calls, dialing out, guiding people to come to get vaccination. And those are part of the equity programs that we're going to be rolling up and ramping up. We've got in our most socially disadvantaged, vulnerable communities that represent about 25% of our population. 22% of those people have been vaccinated, not quite where we wanted to be. We wanted to at least be at the state normal or better. So we've got a little ways to go, but we are making progress there. I think, let me just change gear. It was a pretty big week last week. For the last many, many years, Connecticut has been trying to reach an agreement with our tribal partners, Mohegan Sun and Foxwoods, in order to bring our gaming into the 21st century. And if we've learned one thing after a year of COVID is how much of the world is moving into a virtual world. We've seen that in telehealth. We've seen that in teleeducation. We've seen that in telecommuting. And it was really important both to the state of Connecticut and our tribal partners that we get this right. And we worked hard, David and Melissa and Paul and our team, negotiating this. A lot of people said, just do a deal, just make a deal. We wanted a deal that was in the best interests of, all three partners, best interests of the taxpayers of the state of Connecticut. And it's sort of three pieces. One, it allows us to get into sports betting. You've seen what they're doing in New Jersey and New Hampshire and a few other states. We're ahead of the curve there. That's going to be available both to our tribal partners as well as to the Connecticut Lottery Corporation. That was important because that means allows us to expand and compete there as well. Online casino gaming, that's an extension of the compact. The tribes have the exclusive to do casino gaming in real time. Now they also have the exclusive to do real online casino gaming in the virtual world. There we get a revenue share of 18 going up to 20% after year 5. That's going to represent significant resources for the state and to our tribal partners, probably north of $100 million in net cash flow to each of our tribal partners and eventually to the state as well over a period of time. And Rob and his team at the Lottery Corporation have the right to move from paper to iLottery and draw games at casino. And that's important. I mean, right now, that business, I didn't focus on it, is $1 billion business with about $400 million a year in revenue to the state of Connecticut, which allows us to hold down taxes and invest in key services. So the fact that we'll be able to expand this over a period of time and compete, I think is an important plus for across the state. And we wouldn't be able to do it if we didn't have the right team who were able to take the lead there. I know a lot of people have been, worrying about some of the quasis and the folks who are leading that. And we had some problems in the corporation lottery going back a few years. We've got a good team. We've got a good team right now. Greg Smith, he's the executive director. Greg has been executive director at other states. He's a really good person to help take the Lottery Corporation, to the next level in terms of the virtual space and in terms of sports. And in particular, my friend Rob Simulclair, who's been chairman there. Rob has experience at I think it's ESPN, NBC Sports, a lot of experience in digital media. So I think he's ideally suited to take this major endeavor from the state and bring it into the modern era. Rob, you want to tell us a little bit about what this agreement means to the Lottery Commission, what we can expect to see and when?
Absolutely. Thank you very much, Governor Lamont. I appreciate it. I know when you and I first talked about this role at Lottery, this was really the vision that we had when we first sat down to talk about the chairmanship of this board. And so I want to thank you and your team for the hard work that you put in. You know, this was an agreement that a lot of people didn't think would necessarily happen anytime soon. There had been challenges getting an agreement done. But, you know, thanks to your leadership, the leadership of Lieutenant Governor Bysowitz, and then I have to acknowledge the great work of your staff, of Secretary McCaw, of Commissioner David Lehman, who just did a tremendous job in negotiating with our tribal partners, as well as your Chief of Staff, Mr. Mounts, who's on this call. So I want to recognize everyone on your team for the great work that was done. You know, this agreement between the state and our tribal nations really is it's a once-in-a-generation pact. It sets our state up to be regionally competitive in this fast-growing marketplace of gaming and sports betting that was previously unregulated. Connecticut Lottery's piece of the agreement really has three main elements. First is the ability to sell existing lottery products online, such as draw tickets, things like Mega Millions and Powerball, our daily numbers games. We'll be able to sell that online through you know, mobile apps and other cashless options for people who like to play those games. Secondly, we'll be able to operate one of the three online sports betting platforms that has been authorized by this deal, with the tribal nations operating the other two. And then third, the ability to launch up to 15 retail sports betting locations, so bricks and mortar sports books that will be able to stand up around the state. We're particularly excited about this retail opportunity, as we feel it has the potential to create great new entertainment zones and hubs, as well as jobs, especially in Hartford and Bridgeport, where we plan to really focus on creating a significant presence. Governor, this announcement also is really, as you know, just the beginning of this process. There still needs to be legislation drafted and passed. I know that your team is already getting to work on drafting legislation, and we're hopeful that the legislature will move quickly on that, as time is of the essence here as we try to get to market with these products. The tribal compacts will need to be amended, and those amendments will need to be approved by the Federal Department of the Interior. And then, of course, the state will have to create regulations around this. So we'll have to identify what the regulatory body will be that will regulate this new gaming in our state, and what those regulations will be. So that all needs to happen before we can actually start taking bets. And that's not going to happen overnight, but we're feeling confident now that we've cleared this really big hurdle of an agreement with the tribes. Of course, you know, with additional gaming options in the state, we firmly believe, as I know you do, Governor Lamont, that there needs to be additional resources to assist the small percentage of people who will struggle with problem gambling. You know, we know that it's a very small percentage in our current lottery setup that have struggles with problem gaming, and we want to make sure that we have the resources available to them. We're already in conversations with the Connecticut Council on Problem Gambling about what resources they think they'll need in this new landscape, this digital landscape. And you know, I think the good news is that the online nature of a lot of these new gaming options actually make it easier to both identify and to help people who run into trouble. It's much easier to do that in a digital landscape than it is in an all-cash business. We'll know our customers better. We'll have a better sense of who's having trouble and the ability to help them deal with and get any resources they need to help with any problem gambling. And the last thing I want to say is that, you know, Connecticut Lottery's inclusion in this framework is really great news for Connecticut taxpayers. Over the last 5 years alone, the Connecticut Lottery has returned more than $1.7 billion to the state's general fund. That includes just over $304 million that we've already contributed to the general fund in the current fiscal year. That was after almost $350 million that we contributed last year. we're well ahead of that pace. We're looking to get to about $400 million this year if we continue on the current pace. And we've generated all of that through brick and mortar establishments, cash purchases alone, our traditional scratch tickets and draw games. So now with our state on the precipice of authorizing online lottery purchases and sports betting, with this new agreement, we really think that this is going to enable Connecticut Lottery to significantly grow our contributions to the state.
All right. Well said, Rob. Any questions?
Channel 3 Eyewitness News.
Yes, Governor. First, a question about the coronavirus. We just wanted to know if we know what percentage of our infections are from the variants right now.
I certainly heard in New York it could be up to 50%. I don't think we really know. We're not really doing as much genetic sequences as we could. Josh, anything else to add on that?
Well, we're working a lot with our colleagues at the Yale School of Public Health, and they're doing a lot of sequencing and doing a lot of analysis. They estimate we're probably in the range of 30 to 40% of the cases in the state right now are the B117 variant, but it is an estimate at this point.
Are we specifically doing any testing on the New York variant 1526? And do we have any preliminary numbers from that sequencing?
Yeah, I think they are starting to look for that now, and we don't have any cases identified at this point.
All right. And my final question, this one will be about sports wagering. We have the March Madness tournament happening right now, and I just wanted to know how we might be navigating the collegiate aspect of all of this. For example, New Jersey and Rhode Island, they prohibit wagers being placed on their college teams. So we just wanted to see how Connecticut might go down that path.
Want to take that, Rob?
Yes, thank you for that question. That is an open question right now in Connecticut. As you mentioned, different states have taken different approaches. Some states do not allow college betting at all. Some prohibit it on the colleges that are in their state. Some only prohibit it on the colleges that are in their state when those teams are playing at home. We don't know yet exactly what we're going to do. That's going to be an open question for the regulation process and the legislation and the regulations that are drafted. So we don't know yet, but we're certainly going to be keen to follow whatever regulations are passed.
Thank you very much.
News 8.
Good afternoon. First, for Josh, you were quoted when it comes to some of the more vulnerable population of making progress, not quite there. Kind of a two-part. Once we get all the mobile units out there, will people have, as Hartford Healthcare and Yale is doing, allowing people to choose the vaccine? Will people have that choice? And once all those mobile units are out there, do you expect to see a bigger rise in those people getting vaccinated?
Sure. Well, a couple things. First of all, people have the choice today in terms of which vaccine. It's made visible in the reservation process and at walk-up clinics which vaccine is being administered. But with regards to the mobile units, keep in mind, this is just one more additional set of resources we're adding. We already have a number of our providers doing, we estimate over 1,000 mobile clinics around the state already. And that's at churches, that's at senior housing complexes. So this is going to be another fleet of resources that we can deploy very quickly and flexibly, in the next month and a half to help address the remaining kind of prioritized populations. By the time we get to the late spring, the summer, we're going to have more vaccine than we're going to have people who want to take it. So we envision these mobile units operating almost on an ice cream truck model where you can drive through neighborhoods and you can flag them down and get a vaccination, or they can go park at a popular, a food truck or a festival. So we're just going to try, we're anticipating a future and then, very soon where everyone who wants a vaccine has already gotten one, and now we have to make it as absolutely easy as we possibly can for everyone else to get vaccinated. We're going to, as the governor mentioned, we're going to have additional supports for local communities that we'll be announcing as well. This is a community-led effort, and so many of our communities have already done a fantastic job of doing outbound calling, doing walk-up clinics, doing door-to-door canvassing. And so we're going to be providing more resources through our Department of Public Health to help further ramp up those efforts.
And for the governor, earlier in the month, you said that Connecticut has earned the ability to roll back capacity and so on and so forth. Today, Rochelle Walensky indicated that she has concerns about the states that maybe the numbers didn't indicate that, but still open things up a little bit too soon. If the numbers do go up at all, do you have a point where, relative to what she said, where you would think that, well, maybe if we hit 4 or 5% or 6%, we're going to need to rethink this?
Yeah, I think she was really concerned about those states like Texas that have an infection rate that's much higher than ours, opened everything up, and then sort of dismissed wearing the mask and social distancing. That's not Connecticut. We've kept our capacity very low, and we're wearing the mask. So I think that was the bigger issue there. And as I've said before, I'm a little less focused on the positivity rate, a lot more focused in terms of, in particular, hospitalizations, making sure we continue to have capacity there, making sure our strategy is working, which is vaccinate those who are most vulnerable, make sure they don't have to be hospitalized, make sure we keep our fatalities at a minimum. And so far, I think it's working pretty well.
NBC Connecticut.
Hi, Governor. Matt Austin with NBC Connecticut. I was wondering if you can just provide an update in terms of federal resources that might be coming to the state to help with the vaccination effort, like FEMA trailers and stuff like that. Are there updates on any other efforts the feds are going to be doing here?
You want to take that, Josh, as regards what type of federal support we're getting specifically for testing, vaccination, and the such?
Yes, there is extensive federal support available already through prior federal grant programs through the CDC, which we're taking advantage of. And there's also a significant additional funds in the American Recovery Plan Act, which passed recently, that we're awaiting more guidance on how we can utilize, but we're not letting that slow us down, as we just discussed, in terms of ramping up additional efforts to make vaccines as readily available to everyone around the state as possible. So we're confident we have a lot of resources to deploy, and we're looking forward to continuing to work with our local partners to do so.
And just in terms of these vans that will be going out to certain sites, how will people know where they will be, and do they need to sign up?
Sure. So again, this is all in local partnerships. So the way this will frequently work will be, a church, for example, will want to have a vaccination clinic, and they'll help notify their congregation and help do the outreach, and we'll make sure that the van is there to do the vaccinations. And so it's a community partnership, working with community leaders, community organizations, and just bringing that van directly into that area and make it very simple for people to get their vaccine.
Okay, thank you.
Fox 61.
Hi, Governor. We've heard from health officials. Dr. Koh even said this last week that in order to achieve herd immunity to COVID-19, we would need around 70 to 80% of our population vaccinated, with April 5th opening the door to everyone who wants a vaccine. Do you think we will achieve that percentage here in Connecticut specifically?
I think by April 5th, first of all, April 5th, we open the vaccine to everybody, regardless of age. So it'll probably take another month or two before we get up to those type of numbers. And to be blunt about it, it's going to get tougher and tougher. You may have some younger people who aren't quite as eager to get vaccinated. There we're going to have to do work. There we're going to have to do the outreach. That's why we have these mobile vans taking it to you. And as I said before, maybe we only have 36% vaccinated to date, but look at the number of people who've been previously infected. So that could mean that we're getting closer to that number than we know right now.
News 12 Connecticut. WTIC 1080 News.
Hi, Governor. Dr. Scott Gottlieb of Westport, as you like to point out, was talking this weekend about the intensity of the New York variant in New York, Brooklyn, Queens in particular. And New York was a precursor the first time around for what happened here last March and April. What's he telling you as far as those variants? And if it's in New York, are we going to see the same kind of thing again here?
Yeah, that's a great question, Dave. We've talked about that a fair amount. You do have the variant there. It is not community spread. It's not like those numbers are going up broadly, but as you point out, there are several communities where it has spiked up. Right now, it looks like that the vaccines still work pretty well. I think one of the things that's helping in New York, will help in Connecticut, is the number of people we have been vaccinated, the number of people who have already had antibodies from previous infections. So, yeah, I'm watching that closely. So far, the numbers bear out our strategy, and I think we're ahead of this variant. We'll be okay.
And we've talked a lot about convincing Black and brown Americans to get their vaccines. Some of the polls that came out last week were saying much more likely to deny vaccines are white male Republicans. Who's convincing them to get on board?
Well, I'm really glad that former President Trump spoke out the other day and said it's the right thing to do. And look, we politicize masks. We cannot politicize vaccinations. I mean, vaccinations keep you safe and to keep everybody you come into contact safe. So I really got to believe that over a period of time, there'll be enough peer pressure that you want to do this. My instinct is that there may be some restaurants that at some point say, hey, I only want people coming in who have been vaccinated. I see our first Carnival cruise, or one of the cruise liners is setting sail in a week. That's for only people who have been vaccinated. So I think they're going to find different ways people realize it's the right thing to do, get on with it.
The Associated Press.
Hello, everybody. Governor, the Department of Correction says about 1/3 of prison inmates are not taking the vaccine or refusing the vaccine. Have you had any recent discussions with Commissioner Quiros about how to improve that rate?
My hope is a little like nurses at nursing homes and hospitals. The first pass, a lot of people said, maybe I don't want to be the very first person to do it. We went through a second time 3 or 4 weeks later, and twice as many people got vaccinated. So I'd like to think that what's going on, say, in the correctional facilities is not a political statement. It was just some hesitancy, and I'd like to think we're going to be catching up and getting close to 100% vaccinations pretty soon.
Do you know if those numbers have increased, or do you have any information about inmates who first refused and then decided to get it after all?
Josh, do you have any input on that?
Well, they're still working their way through on the first pass. And you know, I turn the statement around. I think, you know, over 70% uptake, you know, when first offered is a good first step. And I think that is a credit to Commissioner Quiros and his team, who, while we were waiting for vaccines to come, we're already doing a lot of education and a lot of work with the offender population to ensure that they understood that the vaccines are extremely safe and highly effective. And so it's a good start, but there will be more opportunities, and we hope that those numbers will go up further.
Thank you.
Connecticut Public Media.
Good afternoon. I just want to make sure I'm correct on this. You said 80,000 people signed up on Friday with the new age bracket for vaccinations.
I think 80,000 in that age group have signed up to date. Is that right, Josh?
Right, since Friday. So Friday and then through the weekend.
Okay, and how did that go with the VAM system and the local pharmacies? Do you know when people are scheduled, when the latest vaccination date was scheduled for in that age group so far?
Well, providers were only supposed to have opened up schedules to the middle of April. But the thing for people to keep in mind, particularly if people who are still looking for appointments, our providers are putting more appointments out every day, particularly early in the week when they find out what their allocation is going to be, as we cascade the news down from the federal government. So I'd encourage people just to keep looking each day. If you're still looking for a slot, new ones are opening all the time, and we remain confident that we are very much on track to get everyone an appointment by the time we change the next phase on April 5th.
Is anything going to be done differently, or are you learning from this week, or last week, I should say, for the next age group when it opens up to everyone?
Well, I think what we've learned is that we're timing these transitions quite well. As said before, our goal is not to make sure that everyone who comes eligible can get an appointment that day. If we were to do that, the consequence would be the prior phase would take much longer than it needs to, and we'd have unused appointment slots starting to pop up all around the state. So our goal is to really, as soon as we start to see slacking in demand from the prior phase, to move immediately to the next phase. And I think we really nailed that this time, as I think we've continued to learn from prior phases where we've got it pretty good as well. But again, I think we're well on track for April 5th along that same modeling.
Thank you.
The Day of New London.
Hi, Governor. I'm wondering how the vaccination of teachers and school staff is going. Has there been any level of hesitancy to get the vaccine among that group?
My understanding is that the vaccine has been offered to virtually every educator in the state. The vast majority have had their first shot. I'm sure there's still some hesitancy, as there's been in all groups, but our experience has been once the first group has got it and they tell their friend, hey, it's okay, I didn't really have many side effects, and I feel a lot better and I feel liberated, I think you'll find the overwhelming majority of educators are vaccinated within a few weeks.
The Waterbury Republican American. The Waterbury Republican American.
Yeah. Sorry about that, Max. Little operator error. Do we know how many of the fully vaccinated? Can you give us a breakdown between Johnson & Johnson and the other two vaccinations? There's what, about 500 some odd thousand, I think, this today?
Sure. So on that chart, we had 38,578 Johnson & Johnson doses administered. So that's one and done. So those are fully vaccinated. And then the 584,000 fully vaccinated, including the J&J. So about 540,000 fully vaccinated on the mRNA vaccines.
And Josh, when you talked about the 30 to 40% estimate regarding the B.1.1.7 variant, do we know, I guess, how prevalent it might be among Black and Latino and other minority communities? Or is that, we haven't broken out that info yet?
Do not have it broken out that way, no.
Okay. And Governor, today there was a vote in the Commerce Committee to require, well, not require, well, I guess it's require, when possible, 5 days notice of any emergency declarations or orders related to such declarations that affect business operations. You've given some notice, varying degrees of notice in the past, most recently a couple of weeks notice of the reopening relaxations that took place on Friday. So I was just wondering if you have any thoughts on that.
I think it's prudent. As you point out, Paul, we generally try to give at least 2 weeks notice, give people a chance to prepare going forward. So I'm happy to have that additional guidance.
Okay. And I'm sorry, I might have missed it. When do we expect those additional 35 vans to be deployed?
I think you'll see them by early mid-April.
That's right.
Okay.
They're going to be getting ramped up and deployed through the month of April.
Okay, thanks very much.
Hearst, Connecticut Media.
Good afternoon. The state's regulation review process can be somewhat slow. I guess when is the idea that sports and online gambling can start?
Yeah, Robert, Paul, do you want to take that?
Yeah. Well, I think one of the things that we're going to look to do is try to codify as much through the legislative process as possible. to ensure that we can have expedient regulation approval and go through that process. I think, Nick, you're really referring to the current regulation review process that can take close to a year, but we will be looking to accelerate that through the legislative process. It is our hope to have, if the legislature moves quickly on this legislation, allowing us to be able to send the compact amendments to Department of Interior, Bureau of Indian Affairs, that by time at the start of football season in the fall, we should be up and running here in Connecticut.
And now that you have an agreement, do you have any plan to adjust your revenue targets, maybe higher and sooner, realizing that revenue?
We will be doing that review and be able to provide that as part of a sufficient fiscal note to the legislature once we fully put forth the legislation codifying the compact amendment and the agreement to the legislature.
Thanks.
Nick, the wild card in the pack, of course, is how fast, the legislature gets their bill passed, but probably the one we have less control over is Department of Interior. Like to think we can expedite that, so we're being hesitant on adding all the revenues at this point.
Thanks. And just one question on vaccines. Any insight into what the allocation from the federal government might be for the next couple weeks?
I'm told it's going to ramp up moderately in the next week and a lot in early April, probably getting up over 200,000 doses for that April 5th reopening to all age groups.
Thanks.
The Hartford Current.
Hey, everybody. This is Emily Brindley from The Current. First question. So Connecticut right now ranks 7th in infections or new cases per capita. That's 7th in the country. I was wondering, obviously, Connecticut does more testing than some other states, but that has been true throughout most of the pandemic. So I was wondering if, Governor, you might be able to speak about why we might be ranking so high right now and what the state could be doing differently or could be doing in the future to get us off of that high ranking list.
Yeah, I got to take a look at that, Emily. I mean, I look at Florida, Texas, Georgia, some of these states that I thought had a much higher infection rate. You're right, if it's a number of people who have tested positive per 100,000, it is impacted by the fact that we are doing a lot more testing than others. And then you're right, though. This is no time for us to relax. We're looking at New York. We're looking at Massachusetts. Things have ticked up a little bit there. But as I've said before, I'm a little less anxious about the positivity rate unless I saw a big ramp up. I'm really focused on the hospitalizations right now.
And I should clarify that I was talking about new case rate per capita, not positivity rate there. But Connecticut is 7th now, and I know that we've been doing a lot of testing, but as I said, that has been true throughout the course of the pandemic. So it does seem like there would be something else at play right now. Can you speak to what might be at play outside of Connecticut's high testing rate?
Let me get back to you on that. My instinct is that we're keeping up a lot of testing. A lot of other states are doing much, much less testing. There's much less demand for testing right now. Josh, do you have anything to add to this?
No, I think that's right.
So you're saying that it's entirely because of our testing rates? I'm not sure that I follow you on that because we know that Connecticut does do a lot of testing, but that has been true throughout most of the pandemic, and Connecticut has not always ranked so high on the new case rate per capita.
I think I got to get back to you on that, Emily. I'm just hypothesizing right now that other states are doing much less testing, so they have a lower infection count per 100,000. But I'm guessing at this point. So let me just take a look at that. I owe you a better response than that.
All right, I appreciate that. And then I also wanted to ask if the state has the new target for the equity percentages. I know that would change when the eligibility expanded on Friday.
No, we'll publish that on Thursday when we update the weekly metrics on the equity goals.
Okay, and then one last question, Governor. I wonder if you could speak to. You mentioned at the beginning of your comments, your kind of concern about people who are spring break partying maybe in Florida. Do you have any concern about that for Connecticut college students? I know a lot of schools have postponed spring break, but even outside of that, any concern about people traveling while they're remote learning? And what would your message be to those people?
My message would be, if you don't have to travel, stay home. It's a pretty nice time of the year here in Connecticut. If you have to travel, I just assume you don't go down to Miami Beach. I know it looks like it's pretty hopping for spring break. There's also a real risk of a flare-up there. We don't need that. And if you do go down, you don't listen, and you come back, get tested. Get tested. It just will reduce the risk for yourself, your family, your community, and sit back until you get the results of that test. That's what I'd ask, Emily. Thanks for asking that.
All right, thank you. I'll appreciate it.
CT News Junkie.
Thanks, Max. Governor, any change or news on the extension of the emergency powers executive order front?
Yeah, I've been told by Nora Danahy, our new general counsel, that if we're going to continue to receive that FEMA funding at 100%, we've got to get the emergency declaration renewed. And Paul, what's the schedule on that with the legislature?
Sorry about that, Governor. Yeah, thank you, Governor. In terms of the schedule, there's been conversations with the legislature. We gave them an update, gave them an overview based upon our overall research of what's necessary. The one thing that we did let them know is that every state is still currently have emergency powers or emergency declaration to allow them to be able to have access to federal funding, particularly the FEMA funding. And we look forward to continue those conversations with the legislature. I know that they're will be coming in to take on some items tomorrow. We're not 100% certain of what that will be, but we have provided them an overview of what would be necessary as part of the previous conversations the governor had with them last week.
Okay. Pharmacists, I guess, are concerned that there's an executive order that allows them to vaccinate, adults, kids against the flu and the coronavirus for the adults. That would expire on April 20th. Is that one of the ones you guys will look to expand? Because I guess the legislature is not acting there at this time, at least.
As the governor has always stated, that there are many essential executive orders to allow us to be able to fully vaccinate the residents of the state of Connecticut. That's a perfect example of one. As the governor has stated clearly, emergency declaration powers end on the 20th. And as we went through the session, the legislature, if they were against or for various orders, could take them up. But we provided them an overview of an example of some orders, this being one of them, that's important for the overall public health and emergency response.
Okay. Did you guys meet with the Republicans yet on that?
We have currently not met with the Republicans, but we will be in conversations with the Republicans.
Gotcha. Josh, you said earlier that between 30 and 40% of the cases now you think of the B117 variant. Do we have any figures on the other variants that have been prevalent or we've seen here?
At this point, I think the estimates from the team at Yale is that the B117 is the predominant variant, on an upward slope, moving past those numbers you just quoted. The numbers of the others seem to be relatively small at this point. And so we'll continue to publish those data in the Thursday metrics report as we started doing last week.
Do we project that at some point the B117 is going to become the dominant strain of the coronavirus here?
Well, Dr. Fauci predicted that was going to happen in the country a couple of months ago. And it seems like in many parts of the country, including Connecticut, that's the trend line that we're on right now.
But do we have a date where we think that might be?
The modeling from the team at Yale expected by the end of March. We're almost there. So maybe it goes into next month. But I think Dr. Fauci's prediction a couple months ago was end of March.
Okay. Thank you.
The Connecticut Mirror.
Hey, everyone. When you opened up eligibility, or you said eligibility would be opened up to everyone on April 5th, you mentioned prioritization for people with underlying conditions. Has the state come to a determination on how you'll define the comorbidity? And do you have any more information about the primary care physician's role?
Thanks, Jenna. So this is really something that we've looked to the hospitals to think about, and it's really going to be a very limited list of severely, very severe conditions that they're going to look to bring in. And in those cases, because of the nature of, the level of severity and the risk associated with that, we believe they're going to be exclusively people who already have a relationship with one of our hospitals, acute care hospitals around the state, and that's likely where they would be brought in and ensure that they're kind of towards the front of that last phase. People who are under 45 have one of those very severe conditions. But this is something that the hospitals are going to be leading, and we'll have more guidance, or they will have more guidance on that as we get closer to that April 5th date.
So they'll submit something to the state, and the state will then circulate it to all the providers?
It's not going to be that formal. The providers are collaborating amongst themselves to think about what that small number would be. They are in discussions with Commissioner Gifford, and that's something that we're looking to firm up over the next week or so as we get closer to April 5th.
Okay, thanks.
All right, I guess I'm getting this signal. Rob, thank you for joining us today. You're going to be a very busy guy for the foreseeable future. I'll spare you any it's a roll of the dice, it's a good bet type of analogies, and just say right now, I think it's going to be a good spring. We're making really great progress on the vaccine. Maintain your diligence. Skip Miami Beach. Look forward to talking to you on Thursday.